There's 10,000 people a day turning 65 every single day. It's, we're undergoing this huge shift in aging, and all of these people are really not set up for success in their own homes, right? Fewer than 6% of homes have any kind of modifications to support aging in place. So there's a huge group of people who are living in unsafe homes. It's leading to a ton of injuries, health issues, et cetera. And so we're in a position where we can go in there and help them. Just like here. With Jukebox Health, we help older adults and anyone with mobility challenges stay safe, healthy, and independent in their own homes. We do that through a variety of environmental supports, things like home modifications like grab bars, stair lifts, night lights, things like that, but also this long and growing list of environmental support services like mold remediation, pest control, really anything that's going to help keep people safe, healthy, and independent in their own homes.
So everybody wants to stay healthy, especially as they age. And, increasingly we care a lot about the food that we put in our body, the classes, the gym classes that we take, the doing the crossword every day to keep our brain fit and active. But one area that I don't think we spend enough time thinking about is the ways in which our environment affect our health. From the air that we breathe, to the slipperiness of our showers, to the pests that might be crawling in our walls. There's a lot of ways that our home environment can impact our health, especially as we age.
Really early on when we were starting this company, we didn't know exactly what we were going to have to build from a product or technology standpoint. So we were spending a lot of time following occupational therapists around as they evaluated people's homes. We were talking to a lot of older adults and their families. And on this one particular visit, I remember an occupational therapist pulled out a stack of Post-it notes and a Sharpie marker and literally walked around the home kind of taping these Post-it notes up on the wall and writing things like grab bar, nightlight, tripping hazard, whatever. And at the end of the visit, it was all very helpful, but she was like, okay, well, you should go do all these things, have a nice day. And that was the end of the visit. And I realized, she wasn't empowered to do anything to solve these problems for the family. And the family's looking at all these Post-it notes, they're great ideas, but they don't know where to get a grab bar, what size, where to put it, who's going to actually install it safely, or any of that stuff. And so there's this big gap where we realized, the clinicians are walking around with this huge database of products in their heads, right? They know exactly what needs to happen. They've been trained. They know, just by looking at someone, what's going to make their home safer and more accessible. But they have no way of actually getting it done. And so that was it for us. We had to build that connective tissue so that clinicians could make recommendations, and then almost by magic, you could see home safety improvements pop out on the other side. And that's really for us what we've focused the last couple of years on, is building the technology, the processes, the operations to make that a reality.
There's been small local businesses that we find that do bits and pieces of home safety. Maybe an OT here or a contractor here. And, they're doing great work and helping people in their communities. But what's really challenging for those small businesses is to develop the partnerships with large national health insurance companies who need these services for millions of their members across the country. And so what sets us apart is building with that national scale in mind from the beginning, and also putting in place all of the enterprise tooling that is critical. So as we think about how this business is going to evolve over the next couple of years, today we're partnering with healthcare payers and sending occupational therapists into people's home to solve a very acute problem around how do we keep them safe through things like grab bars, motion activated lighting, stair chairs. But as we're doing this, we're building, a trusted relationship with that health plan and with that patient that allows us to deliver a whole number of different services to help keep that person safe in that environment.
There's an overwhelming number of studies that show that clinically led home modifications have a huge impact on people's health outcomes. They reduce falls, they keep people out of the emergency room, hospitals, et cetera. The problem is that no one's really collected the data before to say which modifications for which people have the biggest impact.
Right now, that research is at kind of a 30,000-foot level. It basically says, try a few grab bars and see what happens. We think that the data that we're collecting as we send OTs into the home about what health conditions, what home risks, and how those factors kind of relate and confound, putting that all together and understanding at a much more granular level that for somebody with Parkinson's or diabetes, the right modifications to achieve the most value for that health plan might be something like, grab bars or doorway widening or whatever it might be in each individual's case.
So we're the first people who are collecting that data and saying, look, we know exactly what problems we encountered in the home. We know the medical conditions of these people, their chronic conditions, their functional abilities. Where should we spend our $1,000 budget to make sure that we're going to have the maximum impact, keep people safest given the resources that we have? So we built a lot of the technology to power our occupational therapists, our installation partners, our healthcare partners, to put it all together to be able to make those predictions for them. And over time, we're going to get more and more accurate and be able to solve these things ahead of time much more proactively. We're in the middle of a historic shift in aging in this country, and we're really unprepared for it. More and more people want to live at home, but fewer than 6% have actually made any kind of investment to support aging in place in their own home. As a result, and unfortunately it's quite predictable, we have huge amounts of people falling and having injuries at home. It's a $50 billion a year problem in healthcare costs already. We're spending $400 billion a year in the long-term services and supports to take care of those people after the fact, right? And when you ask people in healthcare, what do we do to solve this problem? They'll tell you almost universally, fix the homes, right? People are falling in their homes. You need to fix their homes. So really, we have to modify 30 million homes over the next 20 years just to keep pace with aging today, right? It's a huge goal. And if that's the only thing we focused on, it would probably feel on a lot of days like we're not getting enough done. So we measure success, one case at a time, one person at a time. We have this incredible impact on people's lives. They go from not being able to use their own homes to really, having full access to their homes, being a lot safer, being able to get in and out of their homes safely. So, we're having a huge effect on people, and I think it's an easy thing to celebrate, and it makes the ups and downs of a startup and building a company from the ground up, it makes it a lot more tolerable when you have something to celebrate every day.
I think most people, by their nature, don't like to brag, but sharing successes as a team is a really core value that we try and instill in everybody. Basically, telling a story about a customer who we were able to help, or a great new opportunity with a partner. Those are the types of stories that when we share them together, I think gives everybody the energy and enthusiasm and motivation to kind of continue forward and succeed.
We thought a lot about the values of the company and who we wanted to be, what kind of people we wanted to attract to this business. Obviously, we have a really important purpose, and so we wanted values that would match that. So it really comes down to three things. It's empowerment, expertise, and empathy. Right? When we hire people really who kind of embody all three, we have client care coordinators who are really the quarterback for the family throughout the whole process. So when you call Jukebox Health, you talk to the same person throughout the whole process from beginning to end. So those people are, just very much, we hire for people who are really empathetic, but we also train them and incentivize them to spend a lot of time with people, understand their needs. They then connect with our network of experts. So we have clinicians, installers, construction folks, project managers. We bring a ton of expertise to bear to figure out how do we solve your unique and individual problems in a way that you want. And then, the last one is empowerment. We really make sure that we're putting the client, the patient, and their families at the center of it. So we try to do whatever we can and make sure that we're respecting their choices and making sure that we're giving them the tools that they need to achieve whatever goals they want, be that living in place or perhaps not. When we first started this, we didn't even know if people were going to let us into their homes. And the most surprising thing happened. 9 out of 10 people whose homes we went into actually turned into customers and started spending money with us and wanted us to come in and fix their homes. And so for us, that was this huge aha moment, like, oh, these people are screaming out for help. They really need the help.
I think if Jukebox is successful over the next decade, we're going to see a change in how people think about taking care of their health, which involves not just the pills they take or the doctors they see, but also the way they think about their home environment and how that might affect their health. And so I think increasingly we're going to see people invest in making improvements to their air quality, to making their home safer and preventing falls. And we all want to be healthy, especially as we age. But I think, if Jukebox is successful, I think we'll have a real change in how we as a society view our home environment's impact on our health.